A 72 years old man undergoes sigmoid colectomy for diverticular disease. Which of the following intervention is most likely to reduce his risk of developing post-operative wound infection? That means a patient undergoing sigmoid colectomy for diverticular disease, but what step we can take to reduce the post-operative infection? So first of all, let's see the colon. This is the cecum, ascending colon, transverse colon, descending colon, sigmoid colon. So what happened? The sigmoid colon will be removed by operation, and what we have to precaution? We have to take precaution for post-operative infection reduction. So what step we can take? Here the options are using plain clear incise type draft to cover the operative field, administrating mechanical bowel preparation preoperatively, shaving his abdominal wall 1 day prior to the surgery, administration of single dose of broad spectrum antibiotic prior to the procedure, and none of the above. So which of the following step should be taken to reduce the postoperative infection? So let's say the administration of the prophylactic antibiotic will reduce the wound infection. So this is the first point, that administration of the prophylactic antibiotic before starting operation, it is the very important step to reduce postoperative infection. And here we can see the plain incise drafts, it increase the risk of wound infection and should not be used. So plain incise drafts increase the wound infection, so we should not use this plain incise drafts. And the iodophore impregnement drafts have been demonstrated to reduce the risk of the wound infection. So iodophore impregnement draft should be used, plain incise draft should not be used. Then shaving 1 day period to the surgery will increase the risk. So shaving usually should be done just before the operation. Why? If we shave the operative area longer time before, then what occurs? There colonization of the bacteria occurs. So when one day before there is the shaving, in this condition colonization of bacteria occurs, and there is also risk of post-operative infection. So what step we should take to reduce the post-operative infection in case of operation? Here the administration of the single dose broad spectrum antibiotic prior to the procedure. Other options here, such as here we can see the using plain clear incise type draft, it is not true, because we should use iodine impregnated draft. Administration of the mechanical bowel preparation preoperatively. The mechanical bowel preparation has no role with the infection. Then shaving his abdominal wall 1 day prior to the surgery. It is not true. We should shave the abdominal wall just before the operation, because when we keep more than 4 or 6 hours in this condition, there is colonization of the bacteria and there is increased risk of the wound infection postoperatively.